Welcome to the Metabolic Link, a podcast that explores the common thread of metabolism in health and disease. This is where science meets society. Welcome to the Metabolic Link. I'm your host, Dr. Dominic D'Agostino, neuroscientist, educator, and passionate advocate for evidence-based nutrition and metabolic therapy. In each episode, we dive deep into the science and the application of metabolic strategies with leading minds across medicine, nutrition, and beyond. Today, we're joined by Dr. Anthony Chaffee. He's a neurosurgeon, medical doctor with a fascinating path from treating refugees in Bangladesh to challenging the conventional wisdom around vegetables. Dr. Chaffee is a U.S.-trained physician and a former professional rugby player who earned his medical degree from the Royal College of Surgeons in Ireland. He practiced medicine on multiple continents, including humanitarian work during the Rohingya refugee crisis, and now he runs a metabolic health-focused practice in Australia. A strong voice in the carnivore and ketogenic communities, he hosts the Plant-Free MD podcast, and he shares science-backed insights into nutrition through his growing online platform. From high-fat diets to Arctic explorers to the reversal of autoimmune conditions in clinical practice, we unpacked a lot of history, science, and we hit on pretty much all the controversies surrounding a plant-free way of eating and what that means for what eating this way means for your brain, for your metabolism, and also for your long-term health. And if you'd like to get a chance to talk to Dr. Chaffee and ask questions directly, don't miss our upcoming live Q&A on the Metabolic Initiative. That's our CME-centered medical education platform. It's free for anyone to join with a trial and happening June 18th. That's 9 a.m. Pacific time and 12 noon Eastern time. You can sign up at membership.metabolicinitiative.com/Dr. Chaffee. And so that's membership.metabolicinitiative.com/DRCHAFFEE. So before we dig in, I want to say a special thank you to our podcast sponsors. They are GOVA Connect, Fatty 15, and ZocDoc. We carefully vet out every brand that we work with, and we use the products ourselves. So we're talking about them, and when we're supporting, with their support, they allow us to get this content to you to make it possible. So we really thank you for checking out their content. And now let's get into it. And here's our interview with Dr. Anthony Chaffee. Dr. Anthony Chaffee, it is great to see you again. The last time we met, it was in Switzerland, and I really enjoyed the time that we spent together. So great to see you again, and thank you for being on the Metabolic Link podcast.
Yeah, absolutely. Thank you so much for having me. It's great to see you again.
Yeah. So I get so many questions about the carnivore diet, and we're going to take a deep dive into the pros of the ketogenic diet. And I guess maybe I get a lot of provocative questions, and I compiled many of them from my email that I think we want to address. And some of it we talked about a little bit offline. Some of the things that I think we'll also address with some of the trends that have been hitting the scene lately. So, before we begin, maybe for a lot of people know of you, are very familiar with your work and the carnivore diet and your platform, but it would be good to give our listeners sort of a background on your education, your training, and how on earth you got steered towards this area of nutrition, nutritional pattern, and ultimately nutrition research and education that you're part of.
Sure, absolutely. So I'm a medical doctor. I did my undergraduate degree here in America. I'm from America, but I played professional rugby in America and overseas, and so I decided to stay abroad for medical school. I went to postgraduate medical degree program at the Royal College of Surgeons in Ireland. Stayed there for 2 years practicing medicine. Then I took some time off for family reasons, and then was doing humanitarian work in Bangladesh, helping with the Rohingya refugee crisis there. There's a actual genocide in Burma, and about 200,000 people, unofficial numbers, were killed in about a month. A million people fled into southern Bangladesh. So I felt I needed to go and help them out because there wasn't much help being provided. After that, I was a bit of a free agent, and I decided to go down to Australia and continue on with my neurosurgical training there. And I've been working as a neurosurgical registrar there the last several years. But then the last couple of years, I transitioned over to a metabolic health preventative medicine sort of practice. Took over a friend's practice who was sort of needed to retire. That has been very rewarding. It's allowed me to incorporate diet and lifestyle interventions, try to address root cause issues and get people off medication as opposed to on more and more medication. And that has been very, very rewarding, seeing diseases that I was taught in medical school and still thought and taught to be irreversible chronic conditions that can only be managed by a symptom point of view or reduced in severity with different sorts of interventions. But you'll never get rid of it, and it will always get worse. It's a progressive disease like diabetes, for instance, or autoimmunity. And I've actually seen that specific diet and lifestyle interventions like a ketogenic diet or even a plant-free ketogenic diet, sometimes called the carnivore diet, can give absolutely near miraculous sort of improvements. And we're actually getting ready to publish some data on that as well on case series, for example, on 12 patients who have reversed MS or significantly improved their symptoms of MS. But not only their symptoms, but on MRI, their lesions have actually reduced significantly in many of these cases, and that's not something that is really seen at all. So that's quite rewarding.
This episode of the Metabolic Link is brought to you by GOVA Connect. Knowing your essential metabolic fatty acid profile, specifically your essential fatty acids, is key to maintaining your body's overall health. Achieving the right balance of fatty acids can help to reduce inflammation, support heart health, and also to improve mitochondrial function. GOVA's Metabolics Plus and comprehensive fatty acid test provides a very detailed report, including the levels of omega-3 fatty acids, omega-6 fatty acids, and also the C15 essential fatty acid to help identify potential imbalances. Omega-3 fatty acids are intimately linked to metabolic health and your risk for chronic early onset diseases. So they should actually be part of standard blood work, in my opinion. So higher levels of these essential fatty acids, they're associated also with life expectancy of 4 to 5 years, optimal levels versus deficient levels. So you can really consider these essential fatty acids as an evidence-based longevity biomarker. So GOVA also offers a focused single marker test for C15. This is an essential fatty acid, as mentioned, linked to healthy aging. So take control of your health by visiting gdx.net/the metabolic link to learn more and to use the code metabolic link for a 15% off any of their test kits. Now back to our episode.
I came through this just through my own personal experience doing this sort of way of eating 25 years ago-ish. I was taking a class in cancer
25 years ago. How old are you? Because you look like you're in your 20s.
I'm 45. Yeah.
Oh, 40. Wow. That's amazing.
Yeah.
Okay. That's a testament right there. Okay.
Eat some meat.
25 years ago. So you're kind of ahead of you're early adopter, I guess we could say.
Yeah, well, it sort of I was sort of in and out because I didn't really realize what I was doing because I was taking a class in cancer biology in my undergrad at the University of Washington in Seattle. And we had a professor there that sort of pointed out that there were a lot of carcinogens in the produce side, the foods that we eat. And so even just natural whole foods like fruits and vegetables had dozens, if not over 100 known carcinogens. So he said that Brussels sprouts had something like 136 known carcinogens, that mushrooms, just the white mushrooms that we would use, many mushrooms will just kill you, but the ones that we eat would have over 100 carcinogens, but also spinach and kale, broccoli, celery, cabbage, cucumber, all the fruits and vegetables that you would eat. We were given lists of these and a number with how many carcinogens had been identified. And so I don't have a source. It was a handout. We just gave that to us. I don't know where that was coming from, but it was left quite an impression. And I remember thinking to myself, well, this is pretty crazy. And everyone was actually shocked. Everyone was looking around wildly at what we were hearing. And I remember thinking to myself, I was like, but vegetables are still good for you though, right? And he just gave us a funny look and he said, that he said that he didn't eat salads and he wouldn't eat vegetables and he wouldn't let his kids eat vegetables. And then he said, plants are trying to kill you. I was like, yep, right. Never mind. And that was the thing. I mean,
Provocative statement right there. Yeah.
very
Yeah.
provocative, and it left a lasting impression upon me, at least. I don't know about my other classmates and what they did after that, but I'd already taken botany and biology. I understood that plants have a defensive nature, just like all life on Earth. Everything has a defense, and while animals can run away or fight back, that's their defense. Or they can hide, or they can use venoms and all these different sorts of things. Everything has a defense, but plants don't have kinetic defenses. They can't run away. They can't fight back. So they have a preponderance of their defenses are chemical in nature. So we have already classified, categorized, and named nearly 1 million different defensive chemicals that plants make in order to protect themselves from predation. And the vast majority of plants on Earth, the hundreds of thousands of species that we know of, almost every single one will kill us or make us very sick. But that's true of herbivores as well. Strict herbivores, cows, horses, etc. If they can eat specific plants because they have the defenses for those specific plants. But if they eat outside of that, they can get very sick. And so, I mean, you have animals, and if an animal
kill them quickly. Yeah, like
yeah,
lantana. It's a beautiful flower. And then we have one sheep that's eating something that's contributing to some health issues. And it's a plant. And they're like herbivores. They're designed to eat plants. And you're not,
yeah,
so yeah, I didn't. I think being a farmer and just having cows and sheep made me kind of vigilant and hyper aware of things because we have neighbors that their cows die or their animals die if they eat the wrong plant. I mean, like extremely high levels of toxins in
yeah.
some of these plants that I have to hit and try to eradicate. So
Yeah, and it may be different for different
yeah,
animals. Like sheep
yep,
and cows can
yep,
eat different forage and do
yes,
fine on that, but they wouldn't
yep,
do fine on each other's.
yeah,
You may have come across some of these veterinary terms: big head, big tongue, limp neck,
hmm
crazy cow syndrome.
yeah, oh
These
yeah,
are
hmm
So these are
yeah,
names of diseases for
yeah,
animals that are actually come from eating the wrong plant, and they
yep.
get very specific set of symptoms, and you say, "Ooh, oh, hold on, they're getting into something they shouldn't," and then you sort of isolate them from that and get them on proper
Yeah.
forage.
Yep.
And another interesting thing is that I found out speaking to a rancher friend of mine that cows can actually get a form of muscular dystrophy, which I hadn't known, and they figured out that it was actually from a selenium deficiency, and so it's
Mhm.
called nutritional muscular dystrophy in cows. And so as long as they have a sufficient supply, as long as the soil has enough selenium, or you provide selenium, mineral salts and things like that on a mineral lick, they don't get it. And I was just thinking about that, like how many diseases that humans get that are one of those things. They're eating a plant or some sort of chemical that we're not designed to have, and it's causing some sort of physiological harm, or we're not getting all of the required essential nutrients in the essential levels that we need them, and we're getting some sort of harm as well. I think that it's quite a lot. I mean, I think it's the vast majority of diseases
Mhm.
that people get are a
Yeah.
combination of that. It's either toxicities and malnutrition, a toxic buildup of a species inappropriate diet, and a lack of species specific nutrition that doesn't provide the required nutrients. And a lot of that comes from plants that we're not designed to eat,
Mhm.
and not eating enough fatty meat because we've been told fat's bad, but also meat's bad. And
Oh
so
yeah.
people have been
We'll get into
avoiding
that.
this.
Yeah.
Yeah, yeah, exactly. So I
Yeah.
think that's the majority of the
Mhm.
issues that people have, and we've also patented over 1 million different chemicals that have never existed, completely novel chemicals that have not existed in nature. 1 million of these have been patented since the 1970s. Actually, well over that, because I heard that statistics nearly 20 years ago now. 1 million different chemicals that don't exist in nature, and now we've just patented these things, and most of them are in the food, agrochemical, or like cleaning or beauty industries and things like that. So these are
Yeah.
chemicals that we would come into human contact with quite regularly. What are those doing? And I would argue that many of them are not going to be positive. And the problem with our system right now is that you can put anything in the environment, in the food supply, basically without proving that it's safe for long-term human exposure. You then have to prove that it's dangerous to get it out. Trans fats. I mean, those only got banned in 2020, which is shocking to me because we were studying that in the 90s or I was told in my organic chemistry class back in the 90s that this was directly linked to atherosclerosis and so on. So, it takes a long time to move this. And we've had these things. We've had Crisco, hydrogenated vegetable oil, since 1912. That's when Procter & Gamble put it on the market. So it's a long time. You can just put it in the food supply, no problem. And it takes a century in this case to get it out. So I think that that's a large burden of disease. And so that's what I've been trying to get out to people, and just so they can make their own conscious choices, try for themselves, and hopefully get healthy. And a lot of people are, which is great.
Yeah. I mean, yeah, it's very interesting thing that you brought up with, well, many different topics, but it made me think that, I mean, people call Roundup a pesticide, but it's really like an herbicide. So, but I guess it would, certain plants are pests or whatever, but I know it impairs significantly the uptake of monovalent and divalent cations, like calcium, for example, is restricted. And if you harvest the plants, and even the food, well, in the context of what the cows are eating too, they're getting less nutrition from plants, sprayed with Roundup ready, crops or whatever. We have sheep, and sheep cannot tolerate even in small doses of copper. So I try to not spray chemicals on our property, but I do spray an aquatic algicide that is copper sulfate. So I kind of go around and spray copper. And then I was thinking after I was doing this, that I have to go look up what the parts per million are going to be, because our cows and sheep roam the property and they go down to our ponds and they drink, and come to find out that I have to be very careful about that. And even cow cubes that we use for training the cows, just like a handful or whatever, have some supplements in it, including copper. And then that could make, different, well, goats can eat anything, but like sheep and different cows and stuff have different nutritional requirements based upon their geographical, location that they kind of grew up in. And sheep, you have to be, yeah, I'm kind of learning all this stuff, like in hindsight. It's like small details, but incredibly important. But there are many, I probably get, nowadays I get about equal amount of emails from ketogenic diets and then carnivore diets. But a carnivore diet is a ketogenic diet. So it's maybe like the first ketogenic diet, right? Until more like the dairy-based ketogenic diets, and when I first heard about the ketogenic diet and was looking at the ketogenic diet formulas used for epilepsy, it was like soybean oil and casein and like a lot of dairy. And surprisingly, like it still had pretty remarkable, just because you're in ketosis, it still had pretty remarkable anti-seizure effects and beneficial effects. But another level of therapeutic benefits could be achieved by a carnivore keto or paleo medicina. They have a paleo ketogenic diet or something. So maybe speak to kind of broadly about, the benefits that you've seen sort of in the clinic, and then that, you're networked with so many people too. So I'm sure you're seeing benefits and things that otherwise may not even be talked about. But
yeah, well, we've been using ketogenic diets for 100 years for epilepsy. And like you say, it could be even a dirty, sort of not ideal sort of ketogenic diet, but being in ketosis is very important. The brain actually prefers ketones. This is sort of a misconception that is readily out there. There's, your brain needs sugar, you have to eat sugar. Well, first of all, even if your brain needed sugar, you wouldn't have to eat sugar, because when you're not eating sugar, you're not eating carbs, you're not eating anything, your blood sugar is going to be dead normal in a typical person in the population. So you have carbs. Your body makes those carbs available. And so there's readily going to be blood sugar available for your brain if it needs it. However, and actually, I was taught this back in biochemistry, nearly 25 years ago. So it's not like this is new. It's not like I'm the one saying this. This is just biochemistry, that when you're in that sort of called fasting metabolism or a ketogenic metabolism, and you start making ketones, 2/3 of your brain will only run on ketones. But remember, we still have normal blood sugar because we're creating normal
Yeah.
amounts of blood sugar. Okay, so what is that? We have optimal amounts of blood sugar and we have ketones, but your brain's only running on those ketones when those ketones are available. So that's clearly a preference. And it's only when those ketone levels start dropping down that your body picks up the slack with the glucose. And we were actually taught that in the so-called fed metabolism, you'll still have a little baseline, tiny little amount of ketones. And if you do, your brain is still running on those ketones. If there are ketones available, your brain will take those in. Same with your cardiac myocytes, same with your enterocytes, same with your muscles, actually. So it's just sort of a supply limitation that we're not sort of running on those otherwise.
Yeah.
So I
Just
think
to clarify, what you're saying is like you don't even need to be keto adapted to use ketones. Like if ketones are
correct.
in your blood, you essentially have, unlimited transport across the blood-brain barrier for
Mhm.
your brain to use them. And when you metabolize ketones or energy, there's a lot of metabolic benefits that come with that. And then ketones are also like a signaling molecule. They have their own receptor. They have, other effects too. So I didn't
Mhm.
actually not know that. I thought when I first started
Mhm.
studying this, I thought you need to adapt over time to
Mhm.
ketosis, but it is, and I think we're basically designed to transition seamlessly in and out of ketosis. So, there are maybe benefits to keto adaptation in regard to ramping up beta oxidation of fats, fatty acids, and
Mhm.
just transitioning your body to run on lower glucose, which happens.
Mhm.
But yeah, it's a good point that you bring up that a lot of people think it's like you either burn fat and ketones or sugar. It's like, no, like, look at your glucose level even after a week of fasting and you're still within normal range, like usually like 3 millimolar, maybe down from like 5 to 3, but
Mhm.
normal. Yeah.
Yeah,
Just
exactly.
your type
And that was
one. Yeah.
actually yeah, and that was actually how my biochemistry professor pitched it, because at the time we are still thinking this is a fed state, this is a fasting state,
Yep.
not seeing the fact that when you eat anything else besides carbohydrates, you're in this so-called fasting state. So you're not necessarily fasting to be in that metabolic state. But what he said was, well, you have to be on ketones all the time because you can't have this, you have to seamlessly transition, as you say.
Mhm.
If you have sort of a gap and your glucose drops down and then your ketones come up, your brain's going to shut off, you're going to die. And so he was saying, well, ketones are the intermediary, they're the bridge, and so you're always running on ketones, and it'll sort of go up and down and things like that. That's how he looked at it. I look at it the other way. I look at it in the sense that ketones are the prime operator, and your brain is trying to get those, and it's only when those aren't available it fills in the gap with glucose, which is a secondary fuel
Mhm.
source. And it makes sense that it's a secondary glucose is a secondary fuel source because when you have both available, your brain chooses ketones.
Yep.
So maybe some property, something that you're eliminating, or maybe just the simple fact that you're having ketones, your brain is working better on ketones. It seems to suppress or raise the threshold for seizures and improve epilepsy, certainly in pediatric populations, but in all populations, it can help. We've been using ketogenic diets called animal-based diets since the late 1700s to treat diabetes, type 1 and type 2. I have a textbook from Sir William Osler, who's the first
Mhm.
professor of medicine at Johns Hopkins. It was my great-grandfather's, and I was actually looking through it, and there's a section on diabetes, type 1 and type 2. The treatment for that was
Yep.
an animal diet, an animal-based diet. So you're just eating meat, and you limit carbohydrates, and it was quite high fat, quite high protein. It wasn't quite 1-to-1. It was slightly below 1-to-1 fat to protein, but that was the treatment, and that was the only thing that was helping people live longer. If it was sort of more late onset, so what we would call type 2,
Mhm.
they had better outcomes. If it was sort of earlier onset, that was met with the worst outcomes. However, it didn't say that everyone died. It's just a lot of them died, but not everyone died,
Yeah.
which is very interesting. And that's
Like
sort of
type 1, you mean? Are you
type
talking like,
ones.
yeah, yeah. I mean, it
Yeah.
kept patients with type 1 diabetes essentially alive. They
Hmm.
thought it was draconian and then but it was used by a number of people to literally keep people with type 1 diabetes
Hmm.
alive. And then insulin came along and then that was, that's a whole nother story there. But
Hmm.
yeah, so these were the first like low carb carnivore practitioners I guess you could say. Yeah.
Yeah, and this was in major medical textbooks from Sir William Osler, who
Yep.
was knighted for his work. I mean,
Mhm.
but he's always considered the best medical educator basically in history. He was
Mhm.
extremely well known and regarded for
Yep.
that, and that was in his textbook, and that's what he said. This is the treatment. And so, this wasn't fringe. This was
Yep.
the mainstream approach for quite some time. And then, yeah, like you said, we had insulin, and then everything became about insulin. In fact, then people are saying, well, now you need carbs and all that sort of stuff. And there's arguments for that. But this was a treatment. And we are also seeing, well, there's a lot of other people too. Dr. J.H. Salisbury, who was using carnivore diets, did a 30-year research project in the 1800s looking at what was optimal nutrition for human beings, lived with the Native Americans, saw they were just eating buffalo and high fat meat diet, and they were extremely healthy. They weren't getting these chronic diseases that other Westerners were, and they could be living well over 100 as healthy, active adults, 110, 115 years old. And a specific example of an elderly couple he mentioned, and they were quite healthy. These spry elderly adults, and so he found that people, it was long before processed foods, that he could reverse autoimmunity and even improve outcomes with tuberculosis, but like rheumatoid arthritis, Crohn's, ulcerative colitis, that he could improve these things or even put them into remission by putting them on just beef and water diets. So that's something that has been used for a long time. I mean, and you see this, Wilhelmer Stefansson, Weston A. Price, Dr. Pottinger, and Price Pottinger Foundation, they sort of linked up. And then even as recently as the 1970s, there was a book by Dr. Walter Volkman, who's a gastroenterologist, who basically wrote a book called The Stone Age Diet. And he just said, look, humans are carnivores. This is just what we've been eating since time immemorial. And if you do that, if you get away from eating these sorts of things, all these diseases will go away, arguing the same thing that I'm arguing, that a lot of these diseases are coming from an inappropriate diet.
Essential fatty acids are crucial for brain function, for hormone production, for your immune response regulation, skin health, and also proper cardiovascular function. C15 is the first essential fatty acid discovered in over 90 years. Low C15 levels can wreak havoc on your metabolic health, and higher levels are linked to many health benefits that we've actually discussed in a previous podcast here on Metabolic Link. So what's interesting is that even without realizing it, most people, similar to magnesium, most people are deficient in C15, which significantly increases or decreases rather our energy levels and resilience if we're deficient in C15. Fatty 15 is a science-backed, award-winning pure C15 supplement. If you trend towards more plant-based, especially if you're vegan, you are most likely deficient in this essential fatty acid. I personally found my C15 levels to be kind of in the good normal range, maybe not optimal high range, but not surprisingly, others have told me that they now supplement C15 due to their tests showing a clear deficiency in this essential fatty acid. So you can get a 15% off of their 90-day subscription starter kit of Fatty 15 by going to fatty15.com/metabolic link and using the code metabolic link at checkout.
In practice, I see this all the time, these chronic diseases improving. We have studies showing that you can put type 2 diabetes certainly into remission with high-fat, meat-based ketogenic diet and animal-based ketogenic diet, or probably other sort of diets, but typically the ones that are used when you're taking away carbs, you replace it with fat and protein.
Yeah.
You can improve. You do that with meat. And cancer, which you're very well familiar with. And that's interesting too, because there are some case series with glioblastoma, which would be sort of my neck of the woods in neurosurgery, that show ketogenic diets are extremely beneficial, from cedar-cyanide, but also other smaller studies, smaller randomized controlled trials, certainly animal models. But there's even a case series out of the Phoenix area, where they did a ketogenic diet, but they actually thought that, well, you're not supposed to eat meat. Meat's bad. So they did a more plant-based ketogenic diet, and they still found significant improvements, like you said. So even if it's not an ideal, what I would consider the most optimal ketogenic approach, it just being in ketosis seems to be beneficial to these people.
Mm-hmm.
And they actually had people reducing the size of their gliomas, high-grade gliomas, which are nasty cancers that are, high-grade gliomas, things like, GBMs, glioblastomas. They're considered terminal. As soon as you get that diagnosis, you're considered to have a terminal disease, which is very sad. But a lot of people are actually showing that these are shrinking down, living long-term by using these ketogenic approaches. Mental health, we have more and more studies coming out from Harvard and elsewhere showing that mental health disorders, depression, anxiety, OCD, bipolar, and even schizophrenia can actually be improved, ameliorated, or even put into remission by using ketogenic diets like a carnivore diet. And autoimmunity, my goodness, autoimmunity is probably one of the most striking, especially for like a plant-free ketogenic diet. So a carnivore diet, which again, like you say, is a ketogenic diet. And I think that's a large part of the benefit that you get being in the correct metabolic state. I don't think that's a fasting state. In fact, my niece was just taking biochemistry at University of Washington. She's pre-med as well. And she was saying they don't even call it fed state and fasting state anymore. At UW, they were calling it a carbohydrate metabolism and a non-carbohydrate metabolism, which I thought was quite interesting and much more accurate. And so I think the being in that non-carbohydrate metabolism, I think that is our optimal metabolic state. I think that is our normal. I don't think it's a shock state. I don't think it's a fasting state. I don't think it's burdening your system. That's certainly not what the studies show anyway. You have long-term studies of ketogenic diets going 24 months. They're not getting rises in cortisol. They're not getting drops in thyroid. They're actually, people are improving their metabolic and hormonal health significantly. And that is what I see in practice as well. And so I think being in that correct metabolic state is really important. Getting your insulin down low. Insulin affects hundreds of different processes in your body and your brain. And when you elevate your insulin by elevating your blood sugar, you're going to be out of balance for all of those things. And I think that's a detriment to our health. And so being that correct metabolic state is I think very important. But then further, getting rid of these plant toxins can be extremely beneficial, especially for autoimmunity. I'm going to be lecturing at again in Switzerland this year. I don't know if you're going to that, but I'll be talking basically about rethinking autoimmunity. I don't actually think that it is an autoimmune reaction. I don't think the body's actually attacking itself for many reasons, and to sort of make those arguments that it's actually these plant toxins that are attacking our body, and then our body's trying to defend against those, and our organs and tissues are getting hit in the crossfire. And that's not just me saying that. I mean, there's a Dr. Fried published a paper in 1991 who argued that. In 1991, he said that the criteria that you need to meet to have this actually be an autoimmune condition for the body to attack itself are really not met. We don't see these things happening. We're just saying, yeah, we think our body's attacking itself. We don't know exactly how, but I bet you it's right. And that's sort of what he was arguing. It's like, look, this hasn't actually been definitively shown, and it doesn't actually follow that that's what's happening. But every single condition that we see can already be explained by the known negative effects of plant lectins, which are a set of defense chemicals. And so he made that argument in 1991. And I think he's right. And I certainly see that in my practice, where if I put people, I have hundreds of patients who have or have had autoimmune conditions, and they improve dramatically. Their symptoms will significantly reduce, and their tissue will even start to heal, like in those cases with MS. Now, there's some permanent tissues that can have permanent damage. And so people with thyroid dysfunction, like Hashimoto's, you can get damage to the thyroid to the extent that it won't recover fully, and you may need to be on medication the rest of your life. Or type 1 diabetes, if you destroy the beta islet cells and they're gone and you can't recover from that, then you will be required to take insulin for the rest of your life, but it will be significantly less because you're not taking in so many exogenous carbohydrates. But I have 2 patients now who we have caught their presentation of type 1 diabetes within the first week or two. I had one patient who is the wife of another patient of mine. She presented to the hospital with diabetic ketoacidosis. Her C-peptide was almost non-existent. Her insulin was almost non-existent. She had antibodies for type 1 diabetes. So it was just bang, bang, bang. This was a clear diagnosis of type 1 diabetes. He brought her to me the week after she got out of the hospital. She's been put on insulin. Her blood sugars are all up and down. Insulin's all up and down. It was a really difficult time controlling this. So we put her on a ketogenic, animal-based ketogenic approach. She didn't go full 100% carnivore. She still had a couple little things in there, but she was mostly just meat and water, a couple little, non-starchy things here and there. And he was really tight on her because she had a CGM. And so his phone would ping if her blood sugar spiked up, and he would call me, "Hey, what's going on? What did you eat?" And she's like, "I had a raspberry." He's like, "Well, don't do it again,"
Yeah.
And so she kept very, very good levels. And we tested her again in 6 weeks, and she, very good blood sugar control, needed, much lower amounts of insulin, much steadier amounts. So even then, even if you don't do anything else, it's already a huge improvement. You're not having these dips and these swings, which can be quite dangerous. And after 6 weeks, all of a sudden her C-peptide is up. It's not normal. It's sort of just below the normal range, but it's there. And it really wasn't there before. And her insulin was much better. Blood sugar controls much better. 6 weeks after that, blood sugar, again, extremely stable, almost no variability throughout the day, and not having any dips or spikes or anything like that. And her C-peptide's high normal, and her insulin is optimal, and she's not taking any exogenous insulin. And her HbA1c was 4.5, and her blood sugar was completely optimal. So,
and the autoantibodies that was mentioned,
haven't checked those yet. Yeah. So typically when I see in autoantibodies, they take a long time to come down. So like look at celiac, you would call that an autoimmune condition. But it can also be called a gluten mediated autoimmune condition. So you have gluten that comes in. It's called a glutenation. All lectins are glutenators. We have a hemagglutinin, wheat germ agglutinin, these sorts of things, which means things stick together. They make things stick together. So they make the villi, microvilli in your intestines stick together. Yep. And then that's causing damage. You can't absorb food properly. It lowers the surface area of your gut, so you can't absorb nutrients properly, causes problems. And then your body says, "Okay, look, that's not right. We need to go in there, step into our body's defense." And I think that's your body's trying to attack the lectins, the wheat germ agglutinin, which is a lectin, and your body's just getting hit in the crossfire because it's stuck to your body. So I think that's casualties of war, sort of civilian casualties. But as soon as you stop eating gluten, your body starts to heal and the damage stops. And within 4 to 6 weeks, your gut can be completely healed and back to normal, even though those antibodies can stay elevated for over 3 years. But they're steadily coming down, just like you would see in your titers for other sorts of pathogens that come into your body that you've been exposed to. Your antibodies go way up. And then they sort of maintain surveillance and vigilance for a long-term period of time. So if that thing ever comes back, you're ready to go. But slowly over time, it's coming down if you don't have any sort of stimulus. And then, maybe 2 years down the road, it's slowly coming down. Then you eat gluten, it slams back up, and then slowly coming down. So it's actually responding to the gluten. It's not responding to your body. So obviously those are not autoantibodies because they're not attacking your body. They're attacking the gluten, or in response to the gluten attacking your body. I think that's what's happening in these other things. So in Hashimoto's, for instance, we see the same pattern. So when you go completely plant-free, ketogenic, just eating especially things like beef and lamb, because ruminant animals can filter out a lot of these toxins, even in food that they're not designed to eat. So if they're put into the food lot and things like that. I found one report saying that they could even break down glyphosate, which is great. Glyphosate is strongly associated with leaky gut and autoimmune issues as well. So maybe that's a further filter that we get from eating ruminant meat. And so when they're eating that, they can improve their energy levels, start to improve their thyroid levels, start to improve. It's very slow because thyroid's you can have permanent damage. It's not going to bounce back like your gut lining. And I see the antibodies slowly come down, but it can take months to over a year or two before those really come down to sort of non-appreciable levels. And if they eat anything, they go on vacation, do something like that, say, I'm just gonna enjoy myself. We'll see those antibodies spike up. And then they'll spike up and then slowly come down. They eat something wrong, spike up again. It's that same pattern that we see in celiac and with other pathogens as well. So, but if my theory is correct and your body's attacking something else. Your body's being attacked by these lectins or whatever, and your body's attacking that. Like in the celiac disease, and you remove that substance, even if the autoantibodies are elevated. If there's, there shouldn't be, if there's no gluten there, there's nothing to attack. And so that's my sort of thought, is like, is that what's happening in other autoimmune conditions as well? So like in Hashimoto's, even though these antibodies are elevated, people's thyroid function is improving, and the antibodies are slowly coming down and the function is slowly coming up.
But
So that
are
would
the
be my guess.
autoantibodies, yeah, just sorry so would the autoantibodies then be, how would they be specifically targeting like the protein gliadin or
Hmm.
gluten? So what I was thinking is, and this may or may not align with the theory, but like, these anti-nutrients or plant-based compounds are damaging the organ, and
Hmm.
then that causes protein misfolding or damage to the protein, then that
Hmm.
the body recognizes that and then creates the autoantibodies from the
Hmm.
plant-based toxin that's damaging the protein. And then, that's how I've always thought about it. Like,
Hmm.
but I think I don't think maybe other people think about it that way, but that's how I always thought about it. But it seems to be
Hmm.
sort of, it may or may not align with your thinking here on that, but
Yeah.
it seems like there could be some parallels. It would be hard to
No, yeah.
sort of unambiguously discern, sort of, if it's unless the autoantibody had a particular signature or affinity to a particular plant-based,
Mhm.
wheat-based protein or compound or something like that.
Yeah, and the thing is that I don't necessarily know exactly
Hmm.
what's going to happen here. Dr. Fried talked about the different sorts of immune responses that lectins elicit in his paper, and that, look, this
Yeah.
is exactly what we're seeing in these conditions. But
Hmm.
is it that your body's just attacking that lectin, or is that lectin damaging and doing something to your body, then your body now does not recognize and then goes after that? It's
Hmm.
hard to say. I mean, I'll leave that to the very clever,
Yeah.
sort of scientists like yourself to sort of, get some biopsies and look and see exactly what's happening. But certainly in practice, when you remove these influences, the problem
Hmm.
seems to go away, even though those antibodies are still elevated, and they stay elevated for a very long time, months, even years.
Hmm.
And I think that's very, 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 very reassuring and very exciting, because this is, for the first time, we actually have a very reasonable treatment for these conditions. And it's not, I mean, actually not the first time. We've been doing this since the 1800s. This is not new.
Yeah.
There's
Hmm.
nothing new under the sun. People
Yeah.
have figured this stuff out. It's just we've forgotten it. We've had it papered over by different things. We've gone down different paths, and then we have to sort of rediscover
Hmm.
the wisdom of the ancients.
Yeah.
But seriously, like they actually we're onto some things.
When was the last time you needed to go to the doctor, but you pushed it off? So you made excuses. I'm too busy. It's going to heal on its own. I think we've all been there. Booking a doctor's appointment can be a daunting process. So ZocDoc makes it super easy to find a doctor, to book a doctor who's near you and perfectly right for you. ZocDoc is free. It's a free app and also a website where you can search and compare high quality in-network doctors and then click instantly to book an appointment. So we are talking about doctors, about booking an in-network appointment with more than 100,000 doctors across every possible specialty. So there's like mental health, dental health, primary care, urgent care if you need it, and more. So you can filter out the doctors that take your insurance, that are located nearby, that are a good fit for any medical need that you may have. And you can also just pick the doctor that's highly rated. So they have a great rating system by verified patients. So once you find a doctor, you can actually see their appointment openings, and then you can just choose a time slot that works for you, and you can click and to book instantly. So appointments made through ZocDoc often happen very fast, like 24 to 72 hours. In some cases, you can book a same day appointment. It's quite common on this platform because there's just so many doctors on it. So this is a product I am now using, and so should you. So stop putting off those doctor's appointments, and go to zocdoc.com/metabolic link to find and instantly book a top rated doctor today. So that's spelled ZocDoc. It's ZocDoc.com/metabolic link, all one word, And so zocdoc.com/metabolic link. So back to our episode.
And so, yeah. And so, yeah, it's interesting because when I was taking, immunology in my undergrad, it was a postgraduate class I was taking as undergrad. And they were, it was very clear, your immune cells are being matured in your thymus, and they're tested against every single antigen, every single molecule that your body can make. And if they react even weakly to any of these things, they aren't allowed to live. They kill them. Right. So you can't mature, you don't have any of these mature cells in the circulation that are capable of attacking your own antigens. And so the body says, well, something went wrong with that process. That's the idea. And so now your body can be sensitized to your own body. Okay, well, why would it, okay, what went, and in the textbook it says, like, well, we don't know, but that would have had to have happened for this to be true. And so, fine. So it's a theory, but does it really act like that? Is your body actually sensitized to your thyroid, say, as if it were an abscess, if it were an infection, or multiple sclerosis or Crohn's? I mean, we generally see a different pattern there. When you have an infection, if you have a pneumonia, if you have an abscess or something like that, your body has a full court press of all your immune cells and antibodies and things like that. And they're really attacking this thing hard until either it's dead or you're dead. Because those are the consequences. If you let bladder infection or kidney infection or pneumonia get out of control, you're going to get septic and you're going to die. And those are the stakes. So we don't really see that in autoimmunity. Yes, we see very aggressive immune attacks, but we also see remission and flare-ups, and it goes up and it goes down and these sorts of things. And the body doesn't do that. If you sort of add this relapsing, remitting sort of behavior with a pneumonia, you're dead. That's just not how your body reacts to an infection. And changing your diet, just getting rid of these lectins and things like that, why would that change? I mean, unless those lectins were responsible for damaging the maturation process of your immune cells. But a lot of these things are already there. Your thymus sort of shrinks over time and doesn't do as much of that. So, why would it go in and out of autoimmunity just by changing your diet? So I think there's certainly a lot of questions to be asked and answered. But at the end of the day, just from a practical standpoint, this is something we are observing. We are seeing that people that stop eating plants go on to a plant-free ketogenic diet. They are reversing these things, putting these autoimmune conditions into remission and coming off their medications. I had one patient, she went to her neurologist. She says, like, look, she's just cannot handle the medications that she's on for this. They're giving her all sorts of side effects. They're very expensive. And she said, look, I want to try this carnivore diet instead. And he berated her and said that was a terrible idea. She was being reckless with her health, and that she was going to end up in a wheelchair and she was going to die if she did that. And she left there crying. She left there in tears. And so, not great bedside manner on his part. But she sort of was even more determined to do this and to sort of just show him. And so she did. So she had stopped her medication, and she just went on just beef and water for 8 months. She went back and her symptoms had markedly improved. And she went and got an MRI with him, and her lesions had actually shrunk by 40%, which you do not see in multiple sclerosis. I mean, even in the studies looking at different drugs and things like that, I actually found one on ketogenic diets and as compared to medications. And the endpoint was, how many new lesions do you have after 18 months, as opposed to, does this reverse it? Nothing. No one's even asking that question because it just doesn't happen. This happened. And her neurologist said, I have never seen this. I've never heard of this. I don't know what happened. I can't explain why this happened. And she said, well, do you think it might be the diet? Because, that's the only different thing I did, and I came off the medication. No, absolutely not. So there's a lot of closed-mindedness, unfortunately, but we are seeing this.
Yeah, there's a lot going on. And just like to recap, and then I have some provocative questions. It's like, from what you're saying, like a carnivore diet, ketogenic carnivore diet, significantly changes your metabolic physiology. That is changing. So it's also, in addition to profoundly changing your metabolic physiology, is changing your brain neuropharmacology, hence the interest in metabolic psychiatry, like epilepsy and things. but it's also it eliminates anti-nutrients. And that could
Hmm.
be coming into play, especially with the MS patient, if there's a provocative agent that's stimulating an immune response. And then what I think about is like gastrointestinal permeability, like repairing leaky gut, and then that then prevents, that's your barrier, function. And then the carnivore diet, is probably I can't think of any diet that has a higher micronutrient bioavailability, because meat is like kind of like the perfect food. And if you're eating like, liver and heart and things like that too, some argue that's, equally, but you probably don't want to eat too much liver because that could be toxic.
Hmm.
I eat it maybe once every week or two. But then you have the satiety and the weight loss effects. And some people that are overweight, maybe, I mean, that's a contributor to poor metabolic health. So it's doing that too. And then the glycemic control and then the anti-inflammatory effects. So you have this like constellation of things, associated with the diet. And that's why it's kind of like almost like a panacea for so many things that you're seeing, right? So now that's okay. You're talking about it in the context of metabolically or nutritionally managing like a severe disorder, right? So,
Hmm.
but then there's the context of this is a lifestyle diet
Hmm.
that I follow. You
Hmm.
have that camp too, and I'd like to kind of touch on that a little bit because I've gotten usually when I'm going to interview someone, I say, I'm going to interview this person, and then I get like, give me your questions. But I have so many questions from my email. And so I have compiled a list of sort of more of the provocative questions. And some of them touch upon like some trends I see online of what people are doing. So here's a question here that I think you're well positioned to answer. If humans evolved as general omnivores, what compelling evidence supports the idea that we're optimally adapted to a zero plant diet? If that's the
Hmm.
case, like, I mean, do you believe that? And, as omnivores, what is the compelling evidence to support the idea that we're optimally adapted for zero plant diets? So, or
Yeah.
zero
Well.
fruit too. So I'd
Yeah.
like to get your,
Hmm.
because that was the second question, but it ties into this is just like, well, what about fruit? Did our
Hmm.
ancestors, if they're roaming through the woods and they see blueberries or, are they going to eat that or did they avoid that? So this is a question.
Yeah. Well, yeah. I mean, I think first of all, what we know humans have not only lived but thrived as 100% complete carnivores. How do we know that? Because we know that humans have been alive in the Arctic Circle during the ice ages.
Mhm.
You're not growing fresh quinoa in that
Yeah.
condition, right? So you're going to have to survive on the animals that are around. You're going to have fish. You're going to have marine mammals. You're going to have the things that prey on them. You're going to have the migrating herds of mastodon and things like that are going through that area to getting to better
Mhm.
pastures and things like that as well. So that's the Inuit. They still live in that traditional way.
Mhm.
Up until very recently, they were just eating in that traditional way. There's nothing growing up there. You're on ice floes up near the North Pole, so you have to
Mhm.
eat animals that down the food chain. You've got plankton and things like that in the
Yeah.
ocean, and then things on land are sort of eating those things in the ocean, and then they're coming on land, and then polar bears are eating those things, and so on. And so we know that people have been doing that. Those are extremely harsh conditions. If you are not
Yeah.
optimized, if you are not exceedingly healthy, then you're not going to make it. You're certainly not
Yeah.
going to make it generationally.
Filtered out. Yeah.
Yeah, exactly. Yeah.
Yeah.
So and yeah, you're just going to get wiped out. Those are extremely difficult conditions to live in under the best of circumstances. If you were missing anything at all from your nutrition, you would not make it past a few generations. We know this from pottingers, cats. They just giving
Mhm.
cooked meat instead of raw meat to cats. After
Yeah.
3 generations, the cooked meat cats could not breed. They could not make a new generation, and they were getting smaller and more deformed, and smaller brains, and
Yeah.
sicker and
Mhm.
weaker, and less bone density. Every generation, they got worse and worse. From what? Right? I mean, you're just losing glutamine, you're losing taurine, different sorts of things from cooking these things out, but you're losing a couple nutrients. And even just the lack of those simple nutrients, they could not survive past a couple of generations. So that would have been us too. And yet people have been surviving those conditions for not only
Mhm.
tens of thousands of years, but hundreds of thousands of years, millions of years. When the fossil record is pretty clear that as the ice shelf started coming down, Homo habilis actually started moving up north into the ice. right? So it wasn't running away like people say. It was like, oh, we're running away towards the equator where all the fruit was. No, they're actually going up into the ice where all the megafauna was, because our ancestors that survived during that time actually survived because they started becoming apex predators. They figured out how to take down large animals with tools and technology and tactics. The other more omnivorous, more herbivorous early humans, they actually all got wiped out. They all died with the advent of the ice ages. So they were the Homo habilis were the ones that were able to figure out how to survive, and they did that by eating animals. Now, we have to first define what we're calling omnivores. An omnivore, I mean, they're pretty loose definitions. It said, an animal that just sort of eats both plants and animals. A real working scientific definition of an obligate omnivore would be one of these two things. Either there are nutrients in plants as well as in meat that they have to have, and so they must get both. Or you can get equal nutrition from both plants and meat. We don't fall into either of those categories. There's nothing in plants that we have to have that we cannot get from meat. And we don't get everything we need from plants. We don't get equal nutrition just going back and forth. We have these toxins, we have these anti-nutrients, phytic acid, lectins, tannins, oxalates, things that will block out and bind to our nutrients to stop us from absorbing these nutrients as well. And bioavailability. These plants have low bioavailability of a lot of their proteins and nutrients. Some of them are completely unbioavailable, such as niacin in corn. There's a lot of niacin in corn. We cannot access it unless we put it through significant chemical processes, which is called nixtamalization, which is what the Mesoamericans traditionally did, because we don't have the biomechanics to do it ourselves, because we're not designed to do that. We figured out through technology how to make more.
They did a lot of mental gymnastics to kind of decrease, like soaking things and fermenting. That's kind of a big thing. So I guess maybe stated another way, just to, if this person is listening. So I think they're not saying it's an obligate but a generalist omnivores. So maybe stated another way, like also like what percentage of the human population, maybe in history or sort of in our past, followed a zero plant diet? And I think what they're getting to, not specifically, oh yeah, I guess they are specifically asking, convince me that the zero plant diet is optimal. And I guess maybe a tack onto that question is like, what I should know this, but what percentage of the population was zero plant? I think I could see eating animals and then a gap between like getting an animal. Okay, we can adapt to eating some of this plant stuff, and then go back to eating animals when weren't successful with the hunt or something like that. So do you know like what percentage of humans were zero plant?
Well, the studies like from Dr. Mickey Bendor, who did a large study on this, and look at all the sort of available evidence, looking at the stable isotope studies and or data, and looking at what we think people ate as a body going back 2 million years. We were termed hypercarnivores, getting over 70% of our calories from meat, right? So that would suggest that some of it was coming from plants, and in certain conditions they were. And so that's the crux of this question is, are we omnivores, or are we able to survive on plant material better than other animals for survival? That doesn't mean that eating plants is optimal. That doesn't mean that that's going to be the best thing that we can do for our health. It just means that we have more of an advantage in times of stress and famine. Because if a lion cannot get meat, it's dead. There are no plant alternatives that it can eat, really. But that it knows of. It's not going to go around, digging up tubers and things like that to survive. We can, and we figured that out. And we figured out through technology how to make them more bioavailable and safer. Fermenting. I mean, that's something that goes back, thousands and thousands of years. So we have these different ways of making things more optimal, or more nutritious and more safe for us. But there's a difference between being able to survive on plant foods and having that be the best nutrition possible. Remember that there's nothing that we're missing from eating plants. We don't have to eat plants. Okay, so what's the advantage of eating plants? What is it that we're getting from plants that's actually improving our health on top of just eating meat? Don't really have an answer to that. There are toxins. We know that there are toxins. We know that there are anti-nutrients that are going to block out the absorption. There was a study with oysters. They had 3 groups, gave them the same amount of oysters, very abundant zinc supply. Oysters just on their own, zinc levels shot up. Zinc with black beans only went up 25%. So that blocked out 75% of the zinc absorption from those oysters just by having them with black beans. You're having a more diverse diet. You should have more nutrients. No, actually, in fact, we got less because of that.
It just
Then gave,
occurred to me that,
Mhm.
like, with plant toxins, like the only thing I think I was watching Survivor, that they were
Mhm.
eating some oysters too can be toxic. Like, so you could have, for example,
Mhm.
I just taught neuropharmacology course, and there's like a chemical in like algae that
Mhm.
activates the kainate receptor, and then oysters or mollusks can concentrate that. And if you
Mhm.
eat that carnivore food, then,
Mhm.
but that's because it was eating plants,
Yeah.
but or
Yeah.
uh, but so there's, I mean, that's kind of maybe a one-off, but I guess I know you hear about people getting sick from eating like certain,
Yeah.
I don't know if there's an answer to the like what percentage of humans were zero plant. I think that's what they're really
Yeah.
zero in, and like what percentage of humans are zero plant diets. But if there was, and you
Mhm.
look at that the poop records, I don't
Mhm.
think that would be there, because I went through a nutrition course, and my professor said, we could tell by the fecal matter that the humans were eating like 200 grams of fiber per day. So they like hammered
Mhm.
into us that they were eating mostly plants and everything. But if they didn't eat any plants, I don't think there would be any residue left over. So it might be skewed in
Mhm.
that way, because that's what like that's what we're taught, right? So there's
Mhm.
like a couple seminal books that really just delved into, like, we know this because we have the fecal remnants of the high fiber fecal remnants of
Mhm.
that. And but I guess there
Yeah.
wouldn't be anything left, like
Yeah.
people that were right. Is that true? Or I
Yeah.
just,
Well,
it just occurred to me, so I'm just rambling.
Well,
But yeah.
no, it could very well be. And also, when you look at the coprolite evidence, you look at sort of, we see that it's like, well, we see these grain materials and the calculi and the teeth of Neanderthals. And at what point? Because, if you go back far enough, you don't actually see all that much of that. And so certainly
Mhm.
within the last 10, 15,000 years, yeah. But that's when the megafauna died out, and people had to start transitioning
Yeah.
over and seeing what else they could eat. A very good example of this is just the genetic record. We have lactase persistence going back 12, 15,000 years, right?
Yeah.
Okay, so
Mhm.
that's in line with when those things died out, and we had to start going to more dairy to get more fat because we're eating smaller animals that have lower percentage of their body being fat, and we actually need the fat. And so we started cultivating dairy and butter and all those sorts of things. So that's something that's very recent. Okay, so we did that recently. Well, what about eating starchy vegetables? We've been eating starchy vegetables forever, have we though? Because amylase, the ability, the enzyme that breaks down starches, so actually only about 10,000 years old, right? And that's with the advent of agriculture. So that's very new as well. So you keep going back further and further, and you see less and less of that. And it's certainly in the ice ages, in the Arctic Circle, there were no plants to eat. No one's going to argue, convincingly to me anyway, that people in the Arctic Circle during the ice ages were eating of an abundance of plants, or required to eat of an abundance of plants because there were no plants. And we see the Inuit doing this up until very recently when they became more westernized. We also saw the Native Americans in the Great Plains. They would eat buffalo. Certainly in some parts of them, people forget that they try to extrapolate from one place. We have Mesoamerica, who had more cultivation, right? And agriculture was independently um, implemented 7 times around the globe, and Mesoamerica is one of these areas.
Mhm.
But we're talking about North and South America. It's connected, so it's actually a supercontinent. It's actually one
Mhm.
supercontinent. You can sort of think of it that way, and is one area that had that. The vast majority of the rest of both North and South America, there's certain areas that had agriculture, but largely that came about with the Western expansion. When the Spaniards sort of came across, they brought that to people, and they
Mhm.
had more and more agriculture. In the Great Plains, with the buffalo herds, they would do a buffalo drop. They'd scare a herd of bison over a cliff. They'd die. They'd, harvest their bodies and mix the dried meat with the rendered fat to make pemmican. It would be very high fat, at 2 grams of fat to 1 gram of protein, 80% calories from fat. And that's what they would eat for the rest of the year. So, and people said, well, they put berries in it, things like that. Actually, they put berries in it to sell to Westerners because Westerners are like, well, this is boring. We wanted a bit sweet. They're like, okay. So they put some berries in it. But the ones that they ate were typically without berries. So, even if they're eating a bit of plants, it's not because they have to, but B, in some of these areas, they weren't really in Washington State and the Columbia River, that they had these weirs and nets and things like that set up. And if you calculate the success of a society and the relative wealth of a society by how much leisure time they have, like how much time they have to spend towards just their basic sort of survival, working, so that they can live. This was the wealthiest civilization that's ever existed on this planet, because they had nearly 100% of their time was leisure time, because they had these nets set up. They had this massive salmon run up the Columbia River, and they just the massive amount of fish. Just all they had to do was just grab fish, and so everything else was their own time. So they're just eating meat all the time. So you have all these sort of examples. The Maasai, again, traditionally they're just eating meat, blood, milk. There's studies going back to the 1920s with the British where they were saying traditionally this is all they eat. But even at that point, they had started incorporating some like millet seed and things like that. That has increased throughout the 20th century, but that's not their traditional diet, even though they had access to it being in a verdant area of Africa. Same with the Australian Aboriginals. There are areas where they cultivated certain crops, but that doesn't mean that every tribe and every nation, the Aboriginal nation, had those same crops as well. A lot of them, going back to original source material from those. That was a book on the European explorers going to Australia from the 1700s, and they have the whole chapter on the diet of the native Aboriginals, marveling at how they were just eating meat. And some places they had specific meats that they would eat. They in Tasmania, they just dove for mollusks. They were getting like abalone and things like that. And even when they were offered like normal fish, they're like, oh, we don't want it. That's not what we eat. And so they had such an abundance of meat and the different things that they ate that they didn't even want different kinds of meat. They're very selective on the kinds of meat that they ate. Other areas are going to be much more barren and much more difficult to attain meat. And they would know what types of plants that they could survive on or use medicinally. That's a very different thing as well, to survive. And but and then there's certain records that say like when they had meat, they ate meat. When they ran out of meat, they knew which plants that they could eat to forage to survive. But then when they got meat, that's what they ate as well. So some of these things are going to be situational, that they sort of required it for survival, especially more recently. But in many of these cases, they still preferred eating meat. Even the Mongols. Genghis Khan, Mongol horde. They hunted, they raised animals, and they ate meat, and they drank horse blood and fermented mare's milk, and they took over the largest contiguous empire that's ever existed. And a lot of histories credit their diet in large part to that, because they were much better nourished than these peasant armies that they were fighting, and they didn't have to stop and cook fires up every 3 times a day. They could just move, and so they were much more mobile. They were much faster. Enemies didn't know where they were, and they just hit you out of nowhere. And so
plant medicine
percentage
too, that you mentioned. Yeah, so plant medicine, right? So if agriculture, like maybe in the Amazon and other areas, there's probably situations, especially if they're not cooking food, that they get parasitic diseases and things like that. And I heard one person was talking about plants were a big part of human nutrition because more of like a garnish, more of like for like plant medicine. I know like we have in our field, I'm looking at it like dog fennel, right? So
Mm,
I noticed that the cows will like nibble on the dog fennel, but they mostly stick to the grass. And then the dog fennel has it prevents, worms and things like that. So you don't have to give ivermectin. So they will eat. That's why they put it in dog pens. That's hence the name, dog fennel. They would throw it into dog pens because it would prevent, it would actually kill the worms and stuff in the
oh,
soil.
good.
So maybe, yeah, I mean, I think that's another idea to entertain that like plants were more of like sort of had a medicinal property.
Hmm.
So I'm going to ask a like more of a geeky question. So our
Hmm.
mutual friend, Dr. Laszlo Boros,
Hmm.
is very interested in a topic that I've been interested in that he put on my radar more than a decade ago. And he reached out to me, I think, in our 2013 paper on ketogenic diets and cancer. A carnivore diet or ketogenic diet causes your mitochondria to produce mostly deuterium depleted water. The final terminal, like acceptor, complex 4 electron transport chains, you're making that water as with the electron flow. That's why, camels can, through beta oxidation of fatty acids, they're generating a significant amount, like we're talking liters
Mm,
amount of water. And that water, by virtue of oxidizing deuterium depleted fats, the will cause the isotopic composition of that is significantly deuterium depleted. And if you're
mm,
making that deuterium depleted water, like at the level of the mitochondria, that can conceivably increase the fidelity of the nuclear genome because you have less deuterium being incorporated into biomolecules. That could sort of trigger oncogenic transformation, right?
mm,
So, I know this is a question that's way out there, but it might be
mm.
fundamentally part of the benefits of, a
Yeah.
ketogenic diet. So I would like to hear sort of your ideas and
Mhm.
opinions about this because I'm sure some of my
Mhm.
people have been asking you maybe just
Yeah, well, I mean, I definitely agree, and
familiar.
I think I really like the research that Laszlo's been doing on deuterium and others as well. It's very interesting. I think it's fascinating. I definitely think that they're on to something major there, and to me, it's very fascinating how all roads lead to carnivore sort of thing. And if this is our optimal diet. If this is what we've sort of are biologically adapted for, and this is what's going to cause them, give us the most benefits and improvements. We should see this. We should see from many different angles things being optimized by being on this way of eating. So I did it from a plant toxin point of view, learning this plants were toxic. We didn't need to eat them, and so so I just defaulted into meat and eggs. And then later I sort of had other sort of thoughts on that. But that was the progenitor of my carnivore sort of existence.
Mhm.
But then, Laszlo is looking at it from a deuterium point of view and said, well, actually, if you eat this way, if you eat in a ketogenic way, you're making this deuterium depleted water. You're getting your parts per million under 130, 120 maybe, and that's going to show significant improvements to your overall metabolic health. And eating different plants, some plants certainly, fruits, etc., will have much higher levels of deuterium as well. And so you're not eating those things, and you're eating in such a way that your metabolism is producing low deuterium or deuterium depleted water and lowering your deuterium level. And that's getting you into this optimal level of deuterium that they've sort of discovered is like this is sort of the area that you want to be in, and sort of above that you're going to get into problems. And it just happens to be that when you're eating this way, which I would consider an optimal way of eating, our biologically appropriate designed way of eating, we happen to get just right into that level that he would
Yeah.
consider, hey, look, this is probably the optimal level for us to be in. So I think that's very interesting. Other people come at it from different points of view. Dr. Sean O'Mara came at it from a visceral fat point of view, studying visceral fat and how important that is to reduce that. And he found that a ketogenic carnivore diet was the best diet to get rid of that visceral fat. So there's a lot of different directions that you can look at this from.
Mhm.
But no, I think that's part and parcel, with this. I
Yeah.
think there are a lot of different ways that this improves our life, and I think that this is further evidence that this is actually our optimal way of eating.
hmm Yeah, and well, you mentioned visceral fat, non-alcoholic fatty liver disease.
Hmm.
There's a radiation interventional radiologist at University of South Florida that had reached out to me, was not really familiar with ketogenic diets, but had a lot of patients that just there's like an epidemic of, fatty liver. I didn't notice until we started doing research on it, and we had like normal subjects, and like 60 to
Mhm.
70% were showing up
Yeah,
with
well,
hepatic steatosis. So, which reversed quickly with low carb, but and he put it on my radar a long time ago, but he had put him on, there's like not too many drugs, or no, the
mm,
drugs don't do anything. I think that was he
mm,
didn't have anything to offer these patients until patients were coming back to him that followed keto, low carb, and he was seeing this and just made me aware of it and said, did you know about this? And 15 years ago, I did not know a whole lot about NAFLD, but that got put on my radar. But they just did like low carb, which brings up another question that I have on my many questions I have here on carnivore.
mhm.
But a question is, why choose carnivore over less extreme approaches? For example, a Mediterranean or a low carb Mediterranean or elimination diets that are easier for people to have compliance for. So yeah, maybe your thoughts on I know, some people, if they could stay, well, you mentioned like 70% of the nutrition from the past was carnivore, but it's like if someone could be like 80% carnivore, are you going to
Mm.
get like, could that be like the default diet? And then if you do have an illness or something like that, you could transition to, you could pull that lever and go, meat and water. And if you have like, a flare up inflammation or some kind of illness that so your thoughts on comparative efficacy and if there's any literature on comparative efficacy of carnivore versus Mediterranean low carb or non ketogenic diets that are not carnivore.
Yeah. Well, there certainly are comparative studies on with ketogenic diets and other sorts of things like the Mediterranean, like the DASH diet,
Mm,
like
yeah.
low fat, high carb, etc. Ketogenic diets, especially animal-based ketogenic diets, seem to do better in a lot of these things. I mean, there was a
Mhm.
study in Parkinson's, there was a randomized controlled trial from Dr. Matthew Phillips, who was also
Yeah.
at the Switzerland conference with us, that he actually lectured at that time, where they did that. They had a very well designed Mediterranean diet versus a ketogenic diet. And he wasn't even worried if it's animal based, whatever. People want more plant based. He was just worried about ketogenic.
Yeah.
And the nutritionist he was working with was like, he's like, hey, we've actually made this, the alternate arm actually too good. This is too good of a diet. We're not going to see,
Mhm.
a lot of differences. But he was like, no, I don't want this to just be better than garbage. I want this to see what is the best. And
Yeah.
so they had a very well designed Mediterranean diet, and both arms improved, but the ketogenic diet improved more, especially for non-motor functions of Parkinson's. And so there are those. I mean, the carnivore hasn't, plant-free ketogenic diets haven't been around long enough in the current era to have many of those comparisons, but there certainly are with ketogenic diets, certainly.
Yeah.
Um, so the thing is that
Which would be by default plant free, pretty much. Yeah. At least,
a
the
lot, a
ones
lot
used for
less, yeah.
like, the
Yeah, you have to.
prescriptive ketogenic diets for epilepsy and things like this. You might add
Yeah.
a strawberry or something, but usually,
Mhm.
yeah, most savvy nutritionists don't really do that. Yeah.
Yeah, a lot of
Mhm.
them. Yeah, a lot of them would be taken
Mhm.
out, and yeah, and so the thing is, there's a gradient. And so,
Mhm.
if you're going whole food, you're getting rid of junk food, you're not being afraid of meat, you're not being afraid of the animal fat, and you're getting more
Mhm.
of these nutrients, you're going to improve. If you start cutting out more and more of the plant toxins, you're going to improve. If you start cutting out more carbs, you just go low carb, you're going to improve. And we see this. Dr. David Unwin in the UK, I mean, he
Mhm.
has hundreds of patients that he's reversed type 2 diabetes with. And it doesn't have to be a zero carbohydrate diet to do that. It just have to significantly reduce it. So therapeutic carbohydrate restriction. It doesn't have to be zero. Just going in that direction is going to make improvements. And we are seeing
Yeah.
improvements from medical points of view. From overall general health, I mean, I didn't have any specific medical conditions. I didn't have diabetes, autoimmunity, etc. But I just felt dramatically better when I just got rid of the last bit of vegetables. I was already sort of naturally ketogenic because I was never really a big fan of bread and all those sorts of things. And I found that when I got back from Bangladesh doing humanitarian work, I was trying to lose some weight and things like that. And I found that my back just hurt bad when I ate any carbohydrates, anything with
Wh-
carbohydrates.
What
I would
did
have
you
like
eat in
horrible.
Bangladesh? I have to ask. I mean, because this
Yeah.
like carbs, right?
Well, they actually eat
Or
a lot of meat. So
oh, okay.
they're more of a Muslim society than like the Hindu
Mhm.
society in India. And so actually they do prize meat. And so I had access to some meat and eggs, especially in the mornings.
Okay. Mhm.
And so I would just load up on meat and eggs.
Yeah.
And sort of in the last sort of couple of weeks, because you're there in the refugee camps for like 16, 18
Yeah.
hours, and you may or may not get many chances to eat. And so
Mhm.
in the
Mhm.
morning, I was just like, all right, look, I'm just going to
When
load
you
up
can.
on carbs and all that sort of stuff. And
Yeah.
actually, I didn't find that was actually better for my energy levels. And I started putting on weight too.
Mhm.
And whereas actually before that, I was still maintaining fairly lean physique, even though I wasn't working out. And so when I got back, I just noticed that anytime I was sort of cutting out carbs just to sort of lean down a bit, I want to get back into rugby. And I found that anytime I had an egg roll or a couple sourdough bread balls, right?
Yeah.
My back hurt for 4 days. My lower back, I had very, very bad back
Mm.
pain for days after that. And I sort of all of a sudden started making that connection. And so I started avoiding it, and my back didn't hurt anymore. And I tried one thing again, back hurt for several days. I'm like, all right, I'm done with
Mhm.
carbs. So I was just eating meat. I was only eating vegetables. And it wasn't until I completely stopped all vegetables and only ate high fat meat, started eating more meat, that I had this dramatic improvement in my health and just how I felt. I mean, I didn't have any specific medical conditions. I just, felt tired and old. I was 38. I'm middle aged. I'm just dying
Mhm.
now. My body's breaking down. And then all of a
Mhm.
sudden, 2 weeks later, I felt like I was 22 again. And I started
Mhm.
playing high level rugby again and felt amazing while doing it. So for me, I mean, there's performance advantages, not just if you have an illness. Some people say, well, I'm not sick. I don't really feel all that bad. I don't have a disease. So, would I really even need to do this? And the thing I point out to them is that you may not even realize how bad you feel until you get rid of all these things and you look at the contrast. I mean, I had no idea that I felt as bad as I did until I all of a
Mhm.
sudden felt a lot better. And I look
Yeah.
back on my life and realize I felt like garbage my entire life, except for right now and those 5 years in my early 20s, because I sort of fell off of it when I was about 25, when I was playing rugby in England. And
Mhm.
so, but for those 5 years in my early 20s, I've never felt better in my entire life. And I could never figure out what it was. I just chalked it up to age. But now at 38, 13 years after the fact, I felt like I was 22 again. I felt absolutely amazing.
Mhm.
And so I just like it because I just feel so much better. And a lot of people feel so much better. I have a lot of patients who say like, wow, I just sort of, I want to, have something else. And they'll add something else in. They'll say, never
Mhm.
again. I'm never doing
Yeah.
that again. I felt awful when I added those things back
Yeah.
in. I didn't realize how much better I feel now until I stopped feeling that way. So there is that side of it as well. And then there's some people that are just so sensitive, especially with
Mhm.
autoimmune conditions, that if they do eat outside of this, they really have a hard time. They have a massive flare up. So they need to stay off this. However, if you just move in that direction, you're going to get better. And you
Yeah.
cut out the
Mhm.
junk food, cut out the sugar, you cut out the garbage, you're going to get better. You reduce the carbs, you're going to get better. You reduce
Yeah.
it under 100 grams, you'll get better. Under 50, even better. Under 20, even better yet. So, there is a gradient, and I think that that's completely fine. Easier, it is sort of subjective. For me, it's a lot easier just to go to the store and buy a bunch of meat. And I know exactly
Yeah.
what I'm eating. I don't have to worry about it. I enjoy it. It's easier for me to just make meat and eat steak. I enjoy it. I enjoy what I'm eating, but also when I eat outside of that, I don't feel good. And so that's actually much more convenient for me to feel my best all the time than have these ups and downs and aches and pains and back pain and inflammation and things like that. And
Totally. I
certainly,
can relate. Yeah.
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 Yeah. And certainly for people that have medical conditions like autoimmunity, it's
Mhm.
far easier for them to just eat meat
Mhm.
than to have these flare ups and have to deal with medications and things like that. So for me, actually, it's much more convenient. It's much easier for
Mhm.
me. Some people have a bit more of a difficult time with that, and that's fine. But
Mhm.
just moving in that direction, don't be afraid of meat. Don't be afraid of fat. They're good for you. They're essential
Yeah.
nutrients you need to have. They will improve your health. Start cutting those things out. And the more you do, the better you'll be.
Mhm.
I do find that there is a bit of a drop off when you add in a bit of plants and these sorts of things. It can drop you down a bit further. So just getting rid of that
Mhm.
last 5% of these different plants and things like that, I have found, at least for me and my patients, that provides a significant benefit to their health as well. So yeah, I mean that's the thing. Yeah, it doesn't have to. It's not all or nothing. Definitely
Yeah,
not.
I love that. I love that term you used, therapeutic carbohydrate restriction or therapeutic carbohydrate reduction. I
Hmm.
think is a very I think it comes off a little bit more palatable for some
Hmm.
people that they can, it's not an all or none, that the more you do it, the easier it gets, and probably the more benefits you derive from it over time as you start
Hmm.
eliminating these things. I have a lot more questions, but I want to we're well over time. So I want to be respectful of your time and also maybe save some for maybe a Q&A or
Sure.
podcast episode number 2 here. But I want to thank you, Anthony, for your sharing your wisdom and your insight and all this information that I mean, you are kind of like the go-to person on carnivore diet. I know you've personally convinced people that were very skeptical of the diet who then
Hmm.
later followed it based on your advice and had very, very good results from that. People very personal and close to me. So I
Hmm.
thank you, for sharing your knowledge and wisdom and insight into this in a way that makes it very tangible for people to sort of enter and at least give it a try. So,
Yeah. Well,
can
thank
how
you
can
very much.
people like reach you or yeah, or just kind of get in touch with you or follow your content?
Yeah, well, I'm available online, so I have
Yeah,
YouTube channels, just my name,
very
Anthony
accessible.
Chaffee.
Yeah,
Yeah,
you're
exactly.
out there.
So,
Yeah.
yeah, and I try to make everything free. I don't have like a paywall and things like that. I have
Mhm.
a coaching group, and we have different groups and meetings. That's like personal time that we're sort of putting into that, but the information is readily available elsewhere, right? So I'm not trying to make this like my business. I have a practice. I like my job. I'm not trying to make this my job. I want to try to get this out to people because it's sort of our birthright to be healthy, and we're getting robbed of that. And so I just
Yeah.
want to get this out there. So all my videos are available for free on YouTube or my podcast that is called the Plant Free MD, as you might have guessed, along those lines. And then other social media I have as well, like Instagram is Anthony Chaffee MD, Anthony_Chaffee on Twitter, X, things like that. And you can find all the other ones through that. But those are the main ones. All my videos can be on YouTube or the podcast.
Awesome. Well, thank you for sharing all this, and we look forward to having you on again, as I know there's going to be a lot of questions coming from this. And thank you everybody out there for listening or watching. And thank you, Anthony, for your time and your expertise and everything that you're contributing really to this, what started as a niche area. And it's been really
Mm.
fun to see it kind of grow over time. And from my perspective, being in ketogenic diets, I get quite a few emails from people saying that how efficacious this was for helping them manage such a diversity of different issues. So
Yeah.
again, a ketogenic diet is, for the most part, or a carnivore diet is a ketogenic diet. So it
Yeah.
is a form of a ketogenic diet that I do think is superior than many prescriptive ketogenic diets that are being used in practice. And I think that
Mm.
needs to be sort of acknowledged. And I think the information that Anthony is talking about here needs to be sort of put into practice by ketogenic clinicians out there and to give it a try over, for example, more of a dairy-based ketogenic diet, which is kind of like the easy go-to kind of barrier to entry to ketogenic diets that a lot of people follow.
Yeah.
Yeah.
Well, thank you very much. And it
Yeah.
was a pleasure. And yeah, always happy to talk about this. And it's
Yeah.
great to see you as always.
Yeah. Hope we can meet in person soon. So
Absolutely.
thank you.
Thank you for tuning in today to the Metabolic Link. I hope today's conversation with Dr. Anthony Chaffee left you questioning some of your long-held assumptions and left you more curious than ever about the power of this metabolic intervention. If you found this episode valuable, please subscribe, leave a review, and share it with someone who needs to hear it. For our private exclusive episodes of the Metabolic Link through science-based resources, and we have hundreds of videos on mental health and clinical insights. For all of this, please click and check out our medical education platform. So that's at the Metabolic Initiative at membership.metabolicinitiative.com. And if you'd like a chance to actually ask Dr. Chaffee directly your own questions, don't miss his upcoming live question and answering on June 18th at 9 p.m. Pacific time, and that's 12 noon Eastern time. So that's exclusively inside the Metabolic Initiative. So sign up at membership membership.metabolicinitiative.com/Dr. Chaffee. That's membership.metabolicinitiative.com/DRCHAFFEE. So until next time, thank you again for listening and for watching.